So a very, very warm welcome to all of you. This is the October Wellness Wednesday, and our topic today is living well with a chronic condition, your role in self-management and brain health. I'm Silke Appel-Creswell. I'm one of the co-founders and the director of the BC Brain Wellness Program, and I'll be serving as your MC today. And I'm really pleased that we're joined by Dr. Patrick McGowan today, and he'll be discussing self-care, self-management strategies, how to seek support from your healthcare team. And I really hope that with today's session, you will explore how you can take ownership of your self-management and empower yourself to look after brain health and ultimately living well with a chronic brain condition. We very humbly and very gratefully acknowledge that we live, play, and work on the traditional ancestral and unceded territories of the Squamish, Musqueam, and Tsleil-Waututh nations. That is where UBC is, and you might be joining us from different parts of the province. And I encourage you to also look up which territory you're on right now. The other part that we are really, really excited to share with you today is that it is actually our birthday. We launched the program, and some of you might have been there when we did launch it at UBC and the Javad Morafagian Center for Brain Health today, 3 years ago. So here's a classic third birthday card. We're still young. And really excited and very grateful to everybody's participation. And with that, I will now actually stop sharing my screen and will introduce our speaker, Dr. Patrick McGowan. He's a professor with the School of Public Health and Social Policy at the University of Victoria, although I just learned it's actually based in Ladner. Patrick's research career is an impressive 30 years of focusing on aspects of health education of people who are experiencing chronic health conditions and the role of self-management. He's been implementing and researching the effectiveness of self-management interventions with a wide range of conditions, including diabetes, arthritis, osteoarthritis, cancer, tuberculosis. And he's been researching the feasibility, the viability, acceptability, and effectiveness of the Stanford University community programs. The research is being conducted at the community level, and that includes Aboriginal communities, Punjabi, Chinese communities, and at provincial, national, and international levels. Patrick is also involved in integrating self-management support into clinical settings, and I could not agree more with you. I think your work is absolutely inspirational, and I'm really pleased to pass the floor to you now. Over to you, Patrick.
Okay, well, good day, everyone. And as I said, I'm Patrick here, and I'm situated in beautiful Ladner, just south of the river, okay? And the name of the session today is Living Well with Chronic Conditions, Your Role in Self-Management and Brain Health, okay? And as you see the logos of the Ministry of Health, we are funded and have been for the last about 25 years by the BC Ministry of Health, so I acknowledge that. And today, we're going to talk about how we can take care of ourselves and live well when we have chronic health conditions. So what I want to do in this 50 minutes or so is maybe tell you a little bit about what self-management is and what the strategies are, how to build skills and confidence to take charge of our needs and emotions, and how to seek support and help from a healthcare team, okay? And so, again, I have to acknowledge that we're supported by them. They make me do that, by the way. So, okay, here we go. Okay, first of all, the definition of self-management, okay? And that just means, you know, like this is important because a number of years ago, everybody was doing self-management, the whole province, every single health professional, everybody thought they were doing it. You know, they would tell people what to do and they say, I'm doing self-management because the people have to manage by themselves. But that's not self-management at all, okay? Self-management are the tasks that people have to take to live on a daily basis with one or more chronic health condition. And these tasks include gaining confidence to deal with conditions, to continue as normal routine as possible, and to deal with the emotions, okay? And so what are self-management conditions? Well, chronic conditions, we have hundreds and hundreds of these chronic conditions. And as you age, it seems that more and more people develop chronic conditions. And I think they say, so probably the average person has about 3. You never have one, you have a couple because they go along together, but all sorts of things. And when you have chronic health conditions, you have to manage. You have to, like, you don't live in a doctor's office. You don't live in a hospital. You live at home. You have a real life, and you have to monitor. You have to take your appointments, medications. Your sleep and rest, your emotions. And if you work and have a family, my gosh, you got to manage all those things. Okay, and you are the biggest health provider of yourself. Okay, because on average, people with chronic conditions can only see health professionals about 12 hours a year. 12 hours a year, that's all you can, and that means everybody, not just, like the expert, the specialist, but, the nurse, physiotherapist, anybody, 12 hours a year. So the implication of that is you're managing by yourself 364 and a half days a year. You're managing all by yourself. That's why it's so important, okay? So when people have chronic health conditions, and we see this on our programs all the time, like the first step is, like in a program, there'd be maybe 15 people in the program, and they sit down and they go around the room and they say their name and what kind of chronic health condition they have, and the problem that the condition is causing them. So when they say that, somebody writes on the pad, the big flip chart, just the problem that people mention. We don't mention the chronic health condition, just the problem, okay? And it's common in any group. People say, oh, I can't do the things I used to be able to do. I have difficulty dealing with those health professionals. I have problem on medications. I have trouble breathing, sleeping, the pain, the fatigue, the isolation. Life seems unpredictable. You have worry about work and finances, and there's all those negative emotions like depression, anger, and fear. Okay, and no matter what group, you go from one end of Canada to the next end of Canada, because we have these programs right across Canada, they seem to say the same. Even though in that group of 15 people, there was around 40 or 50 different chronic health conditions mentioned, the problems are the same. So self-management is dealing with the common problems that almost occur in any type of chronic health condition. Okay. So just to jump the gun a bit, we're offering programs in British Columbia, and we have been doing it for about 35 years. And so far, we've probably provided programs to about 70,000 people. And we have 6-session programs, okay? And it's either in person in groups or virtual. And then we have programs like Toolkit and Active Living. This is a program where it's in English, Chinese, Punjabi, and in Indigenous communities. Where you don't really participate in person or by Zoom, but it's conference call, because a lot of people don't want to use Zoom, okay? Then we have this sort of a one-time meal kit, which is a self-help program called Toolkit for Active Living. Then we have this online program where people participate, 6 sessions, once a week for 6 weeks, and they participate with 25 people somewhere in America, all over the world, and people go at their own pace. And then we have our health coach program, where we pair you up with a person who is your coach, who's familiar with chronic health condition, as a peer. And for once a week, for 12 weeks, the coach calls you and goes over self-management programs and helps you learn self-management strategies to deal with them. Okay. So what do people learn in self-management programs? Well, you learn a little bit of information. Okay, you already are told, your condition, and you get patient education, the formal kind, but you learn from the program, and also you learn from others. Okay, you learn practical skills like taking action, like actually how to get around doing something, the communication skills you use with healthcare professionals, with your family and peers. You learn problem solving. Okay, because you're going to be dealing with problems all your life. You're going to learn decision making, okay? Like making difficult decisions. And also there's cognitive techniques like visualization and relaxation techniques, okay? So the big thing in self-management, there's two different kinds, okay? Self-management, that refers to the behaviors that people engage in outside the healthcare context, like not when they're in the doctor's office, not when they're in the hospital, not when they're in a clinic, but when they go home. What do you do when you get home? And self-management support refers to how people are supported in achieving these goals by healthcare professionals. We can teach people some skills to do it. Okay. So before I start getting into it, there's this thing called levels of evidence. Like when you say this is effective, you think, well, how effective is it? And we have this thing in Canada called levels of evidence. And the strongest level of evidence is evidence from meta-analysis or systematic review of randomized control trials. That's when they take many, many, many studies that looked at the same thing and they put them all together, like say 30, 40, 50 studies, and then you get a round picture. So that's the most effective, like the strongest level of evidence. And it goes all the way down to number 4. Okay, evidence from expert committee or opinions or clinical experiences of respected authorities. Okay, because they don't know for sure, but this is their best opinion. It's still good evidence, but you notice there's levels of evidence. And so what I want to show you that self-management program in many of the things we do achieves level 1A in evidence that it is effective. Okay, so here's the first thing. I'm going to tell you one skill beginning is problem solving. People are going to have problems all their life dealing with work, life, emotion, all those things that I showed you before on the slide. You know, an example, you know, here's problem solving steps. The first step you take is specify the problem and include a reason why you think the problem exists. So here's an example. I'm having trouble sleeping at night because my stomach hurts. You don't just say I'm having trouble sleeping at night, because it could be because you've eaten too much dinner, you watch a scary movie, you're all hyped up about something, but you've got to be really clear about it, okay? The second thing you do is you list the ideas that could solve the problem, okay? So why does your stomach hurt at night? Do you think it's the medications you're taking? Okay. Then you list some ideas that you can think of that might solve that problem. Well, I can speak to my doctor next time. I say I can speak to the nurse. I can phone the BC nurse line or 211, or I can speak to the pharmacist, whatnot. Then you do a pros and cons for each one of those ideas that you thought of, and you select one to try. And when you select one to try, you'll always give it 2 weeks to see if it works for you. If it works for you, then you've solved your problem. If it hasn't worked for you, then you go back to number 2 and try another idea on your list, because maybe another idea would work. If you've tried everything over, you know, every single idea you can think of, next step is you ask for help from colleagues and friends, from people that you respect, that you think might have some experience or some knowledge about it. And then in the end, if you can't solve the problem after trying all those things, you just think, maybe the problem isn't solvable at this point in time, because in real life, sometimes the problem isn't solvable right now at this point in time. But give it a break for a little while, a couple of weeks, and then try again, because lots of times problems are solvable at a later date. Okay, so that's problem solving steps. Okay, and when you manage your chronic condition 364 days and a half hours a year, you have to solve problems. Okay. Here's another example. This person had hurt himself and had a wound dressed. And when the health professional visited this person hadn't changed the wound. So you identify the problem and why. So the reason why is I'm not changing the dressing regularly because I'm afraid I won't do it properly. So then the person gets the person, well, do you have any ideas how you might be able to solve this problem? Like you're afraid that you won't do it properly. Okay. So what ideas have you got that might resolve that? Well, do it and have the nurse watch me and give me feedback, or maybe get the nurse to show me how to do it again, or maybe have the nurse check it a few times, or maybe get written instructions, or maybe have someone I can phone if I need help. or maybe there's instructions on a video I can watch, or maybe get my partner, buddy, to do it, to learn how to do it, and he can give me support in doing it. And the third step, you select the idea to try. Well, in this case, the person got their buddy, their partner, to learn how to do it as well, so that when they change their dressing, he'd have support. Okay. The level of support for problem solving is 1A. That means it's the strongest evidence in the world that it works. People learn to solve problems. Like if there's a man and he lives on an island off the Queen Charlotte coast and he's starving, you don't go up there and give him a fish. You go up there and teach him how to fish, because he's going to be experiencing problems all his life. Okay. Now, another self-management strategy is action planning. Okay, people want to do things like people, you know, you should be walking a bit, doing a little bit of exercise. We all know that in the world, but hardly anybody goes walking. Like, why is that? We all know it. We've heard it a million times. So the idea is like, how do you get started? So you make an action plan. An action plan is something you want to do. Okay, I really want to go walking. I know I should, and I've been knowing for many years, and I'd be good at my age and everything else. It's reasonable. I can walk. I don't have any pains or anything else. It's a behavior. And an action plan will answer the questions. What am I going to do? I'm going to go walking. How much? Well, I'm going to go maybe half an hour. When are you going to do it? Tuesday and Wednesday after dinner. And how often? Oh, I'm going to do it 3 times this week. And then importantly, you ask a person, how confident are they that they're going to do what they said? That's their confidence level. And it has to be on a scale of 0 to 10. It has to be 7, 8, 9, or 10, because the more self-efficacy a person has that they'll do it, the greater probability they do it. And that's the theory that all these programs are based on. When a person has a strong belief that they can do something, they probably will do it. When they have a low belief that they will be able to accomplish it, they don't do it. Okay. So action plan, another example is, well, something like you start off with a goal. Well, something I want to achieve in 3 to 6 months. And my goal would be, I want to be exercising regularly, maybe 5 hours a week somehow. Then you make a little action plan, a little small step. This is how you get started on it. So between this week and next week, I'm going to buy a pair of running shoes, because I can't go walking, exercising with any running shoes. And then the third thing, the confidence level. So get the person to say how confident they are that they'll actually achieve what they just said on a scale of 0 to 10. So to get a pair of running shoes this week, I'm 8 out of 10. Okay. And then there has to be an opportunity at the end of this period of time for a person to report back to someone. You make an action plan with someone, your spouse, a healthcare professional, anybody, a partner. So you remember the action plan that you made last week, Patrick? You said you wanted to buy a pair of running shoes. How'd you make out? Okay. If you don't have that reporting back, the whole system falls apart. Okay. So that's action plans. And action plans, again, 1A evidence, is probably action planning, probably, in my opinion, the most effective behavioral strategy used in any program. Okay. Now, the third one is decision making. It's really hard, because health professionals ask us now, well, what do you want to do, Patrick? Like example is, let's say Patrick has type 2 diabetes, and he's had it for many, many years, 20 years or so. And he's not taking any medication now, but he's not feeling very well. So he goes back to his doctor, and the doctor looks at your charts. Well, Patrick, we've been dealing with each other for 20 years now. And first of all, you tried this medication and you took it for so many years, and then you stopped taking it because of some side effects you didn't like. And then you tried this other one, and then you stopped taking all medications, but you're not taking any medication now. And like, I don't know what type of medication to give you. Okay, it's all by trial and error. So there's this new medication, Patrick, and the government of Canada just approved it, but it hasn't been around for a long time. Do you want to take this medication, Patrick? So all of a sudden, the question is back to Patrick, and I have to make the decision whether I want to take medication or not. So I'm stressed, So there's a process where you write down the options, okay, and it's only works if there's 2 options, yes or no. I'll do it or not. Do this or do that. Then you write down the 4s for you, so doing the action, and the againsts for the action. And you give each score a statement of 1, meaning it's not really that important, to 5 being very important. Then you add up each column and compare the results to see what the final score is. And then you ask yourself, you give yourself the gut test. The gut test is that feeling down your stomach, right over behind your belly button. You know, like, how do I feel? What's the right thing to do? And then you make your decision. And you always go with your gut test. Okay, you can do the thing one more time if you want, but you know, here's an example of Patrick and do we take the medication? Well, the 4 is it. Well, it might make me feel better. I'll give that a 5. It could help prevent complications. That's important. So I'll give it a 4. And maybe I might be able to do more. Okay, 4, up to 5 again. So total score of 14. And then the reasons against trying this new medication. Well, there just another, might be a side effect I don't like. So that's 3, that's sort of middle importance. And it's just another pill to take. Well, I'll give that a 1. Maybe it costs too much. I might not be able to afford it. That's 3. And it might not work. So 4. So you hear the reasons why I came with trying to decide whether I should take this new medication or not. 14 would be the score of saying yes, and 11 for no. But the main thing is I reach down and I think in my feeling, my gut test, what is the proper thing do I feel would be right to do? And I'll go for my gut test. I'll say, yes, I'm going to take that medication. Okay. Because people are stressed when they have to make big decisions. And you see this especially in some chronic conditions when these consequences may be severe, like in the area of cancers and whatnot. Like people don't have all the information and the outcome. It's up to you to decide. Okay. When people can look at some factual information as well as emotional information, when you combine that, people feel much better in making the decision and they don't feel that much stress. Okay. So that's making hard decisions. And like you think of it, this applies in any day. Anyway, here's a person near end of life. Okay. And he's talking with his spouse and she's saying, like, what about power of attorney now? Like advance directive, what should we do with, making all these decisions? And he's having a hard time trying to figure this out. And you can actually see him a little bit stressed there. Okay. So he goes through this process. Well, the reason why he thinks that he should give it to his oldest son is maybe the extended family will feel happy. So give that a 2. He'll be happy that I chose him because he'll have power, over finances and, decisions and everything else. So that's important. Maybe it'll bring us closer together, 4. And I know his children will be happy too. So give it a 5. But then you look at the other side, the reasons why you don't want to give him power of attorney. Well, maybe his stability. He hasn't really worked at any job over the years. He's been sort of going from one thing to the next. His life is sort of a little bit of shambles. His current situation, he's not working now. He's drinking quite a lot. Maybe our current relationship, well, we've never really had a good relationship. It seems that we've had our opinions. Okay. And maybe I can't trust his motives. When he makes decisions, will they be really on my behalf and my betterment or maybe for his betterment? So you add up the 4s and againsts, and then you see the reasons for giving him the power of attorney, the power would be 16, and the reasons against would be 12. And that should say, you should give it to him, but you look at your gut test. Now, if that was you, would you give the power of attorney to that particular oldest son or maybe another person in the family? So in this case, he decided not to give the power of attorney to that oldest son. So it helped him make a really difficult decision. Now, the same situation, here's the case when we were working in cancer. Okay, Nigel is 49 years old, divorced with 2 teenage children who he shares custody, and he has metastatic colorectal cancer. He just returned to work as a civil engineer. And when you ask him how he's doing today, he gives you a detailed description about how he's not feeling well at all. And he states, I just can't handle the stress. I'm not sleeping. I'm worried all the time. And I'm worried about the latest scan results. which I get next month. I know I'm supposed to be taking antidepressants that they describe me, but I just don't think they're helping. I just can't cope with how terrible I'm feeling today. My emotions are all over the place. And he sounds like he's struggling and trying not to cry on the phone. He's not been following the doctor's recommendations about the antidepressants either. My doctor told me that I should try taking them and try exercise because it helps with depression. But I think if I can get stronger, maybe I give it a try. I know it will help, but I'm just too tired. He says that he knows his situation is having an effect on his children. Lastly, he tells you that he has had a discussion with his boss who thinks he should consider taking sick time until he can get everything in order. But the decision needed to be his. He realizes he needs to consider his boss's suggestion. So he's in a situation now completely stressed out. How do you make that decision? So he follows this process again. Should I take sick leave? And think of it in your own context too, in your job, if you're a health professional or anywhere else, there's pros and cons of taking a sick leave, okay? The pros that he thought of is, well, I just can't keep everything together now, so that's important. I give it a 5. And it's hard concentrating at work. And my kids are feeling the stress. I'm just too tired and I can't get a good night's sleep. My work colleagues see me in this terrible state, and maybe I'll have time to exercise. If I do take this sick leave, add those up and the score is 25. And then the cons, well, work keeps me preoccupied and I'm not worrying. And I want to keep my regular income coming in as well. I worry it might jeopardize my job status. Maybe it'll make my kids worry. And in my family, we're all strong individuals. And I don't think I know what to do all day. So you look at the scores, 25, 24, they're about the same. But he's had a chance to look at all those things together and then feel it in his gut. So in his gut, he decided that he would take sick leave. Okay, that's the self-management strategy that has level of evidence 1A as well, strongest evidence. It helps people when they're dealing with these emotional dilemmas you have to decide. Okay, so who can participate in these programs we have? Well, anybody who's an adult. We tried many years for a teenage program, but it just didn't work. Different dynamics are in play, okay? It's available in a choice of formats, either in-person group programs, virtual Zoom programs, telephone, conference call programs, self-help programs, or even online programs where people can participate at their own pace. Any person with a chronic health condition, okay? And spouses, caregivers, family members, whatnot, are encouraged to participate as well. Okay. When people take the course, they get one book or the other, depending on what their focus is. The one is Living a Healthy Life with a Chronic Condition. That's sort of a general book for all the chronic health conditions. And then we have a special book just for chronic pain. And those programs don't follow the book, but people want to read about things. They always want to read about something. So like this is a good source of reading about it. Okay. Now, remember the distinction between self-management, that's what we do ourselves outside the context, like not in the doctor's office, not in the hospital. And then self-management support are the things that health professionals can help us with, some strategies. So I'll go over a couple of those now, okay? So here's one strategy. Here's version 1. The nurse says, "Oh, what brings you in here today, Patrick?" "I have headaches." "Oh, you have headaches. My goodness, Patrick, where are the headaches? Where in your head are they? In the front or the back one? And when you have a headache, how long do they last? And what do you do to relieve the headache?" Okay. So we're right down the road focusing on headaches here. Okay. Here's version 2 of the same thing. "Hi, Patrick, what brings you in here today?" "I have headaches." "Well, what else?" "Well, I have troubles sleeping." "Anything else going on in your life, Patrick?" "Yeah, I'm really worried about my son. I think he's using drugs." That's the same person seeing the same health professional, but in one case, the health professional started down this path. Now, it's understandable that sometimes health professionals do this because, you work, you're busy all the time. And also you've been around, like you have experience in life, you know how to, and also there's this sometimes in some professions, this fixing mentality people have. I can fix the problem for you. But you're barking up the wrong tree unless you give a person an opportunity to really say what's wrong with them. Okay. Second technique would be setting the visit agenda. This is when you go and see a health professional, which is really important in communication with things, you have to have time to say what's really on your mind. So here's a little lingo here, a little script. Hello, Ralph. Long time no see. Ralph, we have 30 minutes together today. I need to talk to you about the way you're doing this dressing. What is it you need to talk to me about? So in this case, you say how long you have, and then you go first to model what's going to take place. I want to talk to you about the dressing, and then what is it you need to talk to me about? So at the end of that, both people had a chance to talk about their priority concerns, setting the visit agenda. Okay. Another one, closing the loop. And closing the loop all the time is, as health professionals, we give information to people, okay? And we just expect that people will just get it right when they leave. They got everything right, okay? And, when they did studies, in the area of, for instance, type 2 diabetes, about half the time this happens, people don't get it right. And it's not that they're dumb or they're, can't understand things, just you're so emotionally stressed, it's hard to listen to all the things that might happen, everything else, that it's really quite difficult to get it right. And so closing the loop is a technique to make sure that a person has it right, because if they only see a health professional for 12 hours a year, if they take the time and effort and travel to a place where they get professional help, and then they leave with it wrong, what a waste of time that is. They've lost their opportunity. So it's just an example, the healthcare provider said, well, 3 things help with prevent complications, Patrick: improving your diet, exercise more, and taking medications. Can you repeat that back to me so I know it's clear? Yeah, you eat less, you walk more, take pills. Good. Where do you start? I mean, that's just a simplified way of saying it. But you can say things in different ways. You can say, boy, Patrick, I've really talked a lot today, and I said a lot of things. Can you just tell me the main things that you heard? Or when you go home, what are you going to tell your spouse? Okay. That way, the healthcare professional can be assured that Patrick has the information right. Okay. So now these programs are offered province-wide by the University of Victoria, and that's the way people register programs. Either they phone the number, toll-free number, that number, or else they go on a website and they choose a program that they want to take themselves. Like sign up, you do it on the spot. Okay? And people can take as many programs as they want. You can even take a program a second time or third time if you want. It doesn't matter, because there's no, we followed the patients as partners philosophy in British Columbia. It's up to the person how much education, how much help you need. And the person may start off with one program and then come back and do another one. Okay.
So thank you very, very much again for being with us today. And again, also a huge thank you to everybody who has participated, for your interest. And of course, as always, to our supporters. As you all know, the program is entirely supported by donations, and so we rely on those to be able to offer the program for now 3 years. And so a big thank you to our supporters. And if you do want to support the program, you can go to the website and there are links there. And with that, I wish you a wonderful Thanksgiving weekend and have a lovely rest of the day.